Rapid AI and Inari Medical decided to kind of join forces and just put this together and get you guys. We have a lot of influential people in here, you know, a lot of division leadership, a lot of hospital leadership and physicians that make a huge impact on the patient pathways. So, you know, for us, it's really just about creating some awareness and some education, sharing ideas, and, you know, figuring out ways that we can take a step to just get a little bit better and, you know, take care of patients a little bit better.
I never knew that blood clots and blood clot prevention were the problem and the issue that they are today in America. Blood clots are killing more people than breast cancer, car crashes, and AIDS combined. Senate Bill 612 was signed into law by Governor Ron DeSantis on June 5th. The bill established a legislative policy work group charged with examining how blood clots are affecting people. Ladies and gentlemen, this is where you come into play. The docs in Florida will get to decide where the standard of care is. What is it that we agree on? What is it we don't agree on? This is Florida doctors' opportunity where you don't have to wait for the AMA to spend 10 years, 15 years of your career trying to decide what to do or to dither with it. Florida will be able to decide. And where Florida goes, the rest of the country is going to go. But I can tell you, the things that you can get consensus about among your colleagues, say, yes, these are the 3 things. These are the 4 things. Let's do these 3 or 4 things, and you can change the world.
We have to advocate for our patients. We need to recognize what patients meet the criteria for submassive and massive PEs. We need to be able to call our interventionalists as soon as we can and talk to them about the patient. Let them know. If you don't call them, they're not going to know. And we have to get all on the same page and do what's best for the patient. That's where the biggest success for that is creating some sort of PERT team so that people can collaborate and talk about the patient. The next quote is basically talking about how what we do as physicians, trying to create medical reform and improve processes, it takes time. We can move the needle with education and doing things like that, but what we really need is someone like Doug, who is taking this to the state level, with lawmakers, with hospital administration. That is not just gonna move the needle, it's gonna break it and bring it over to like game changer status, right? That's what we need. And of course, you have my support, and every physician, I think, in the room, and I probably across the country would say thank you to Doug for everything that he's doing. Him and his wonderful family been through a lot, and I think this is to do this, and you are literally going to save thousands of patients, and we're able to create a standardized approach to these patients. How we don't have a standardized approach for these patients is beyond me.
We hadn't done a mechanical thrombectomy of a pulmonary embolism yet, and we had a patient that needed it, and so we decided now's the time to do mechanical thrombectomy. And so I was the lead nurse for this procedure, and it was like a 55-year-old male. He came in, he's got a heart rate of like 120, his BP's normal, 120, 130, systolic. He was doing okay, but he was short of breath. He was sat in like 88% on a couple 6 liters, respirations 25, pale, just not looking very healthy. And so I'm watching the angiogram live going on, and all of a sudden we got a hold of that clot and we sucked it out. And I knew that because his heart rate went to 80, which is like, hey, heart rate of 80, that's great. I wasn't expecting the blood pressure of 70. And so, man, I slammed him with some Neo, gave him some fluids, boom, blood pressure came right back up. And within 5 minutes, he's pink, warm, dry. He looks great. He's not sweating. He's not short of breath. And he's like, wow, thank you. And at that moment, I was hooked. I said, this is why I'm doing what I'm doing, because I saw a dramatic impact. And I'm like, that patient would have died, but we proactively went and abstracted that clot and saved lives. We want better patient outcomes, and you've spoke to that, so I don't have to go into any data about outcomes. But I think, again, we all can agree that we want to elevate patient care, we want to decrease mortality, and we want patients to go home to their families, and we want to prevent deaths. I'm thankful to see Doug and other leaders actually starting to do this and go after and create change. But all of you have that opportunity to actually be the change that we all say we need. So I encourage you, go back to your hospitals, go back to your administrators, go back to your health systems and say, hey, we are actually going to change things around here, and it's going to be for the better of our patients. Thank you.